of information to share with you today, so bear with me if I take slightly longer than usual, but I'll start with the update on the COVID statistics for Scotland. I can confirm that an additional 50 positive cases were confirmed yesterday. That represents 0.9% of the people who were newly tested and takes the total number of cases now to 19,457. The full Health Board breakdown will be available later as usual, but my provisional information is that 15 of the 50 new cases are in Grampian, 10 are in Greater Glasgow and Clyde, 3 in Lanarkshire and 12 in Tayside. And of course, we're dealing with known clusters in each of these areas. I can also confirm that a total of 248 patients are currently in hospital with confirmed COVID, which is 6 fewer than yesterday, and 2 people are in intensive care, which is 1 fewer than yesterday. I'm also pleased to say that yet again, in the past 24 hours, no deaths were registered of patients who first tested positive over the previous 28 days. However, we are reporting a death today that was registered on the 21st of April, but which has not been previously included in the figures due to a delay in Public Health Scotland being made aware of the positive test. I am, however, advised that the deceased person's family was aware that this was a COVID-related death. But taking account of that, I can confirm that the number of deaths under the daily measurement is now 2,492. National Records of Scotland, though, has just published its weekly update. It can be found on the Scottish Government's website. It includes deaths of people who had been confirmed through a test as having COVID, as our daily figures do, but also cases where COVID is a suspected or a contributory cause of death. The latest NRS update covers the period to Sunday just past, the 16th of August. And today's update shows that by Sunday, the total number of registered deaths with either a confirmed or a presumed link to COVID was 4,216. Of those, 3 were registered in the 7 days up to Sunday. That's a decrease of 2 from the week before, and it's the lowest weekly figure we've seen since the pandemic began. One of those 3 deaths was in a care home, which is 1 fewer than in the previous week. These figures continue to speak of the progress we've made in recent months. However, they also remind us that more than 4,000 people have lost their lives to this virus and that people are still losing their lives to it. Every single death is a source of grief and heartbreak, and my condolences again go to everybody who has suffered loss. And I'll also take this opportunity again today to thank everybody who continues to work hard in a variety of different capacities to get the country through this difficult period. The final statistics I want to update on are today's GDP figures. They cover April to June of this year, and they show that Scotland's gross domestic product fell by 19.7% in that quarter, but grew by 5.7% in June as lockdown began to ease. Overall, though, the size of our economy is down 17.6% on February, the month before lockdown. Now, it's important to remember that although lockdown eased in June, large parts of the economy, for example, most retail, hospitality and tourism, at that point remained closed. So we would not expect to see a full recovery yet in these figures. But the figures do, however, reflect the scale of the economic challenge that we face. They also underline the need for continued government action, both Scottish Government and UK Government. The Scottish Government has already allocated more than £2.3 billion to help businesses and protect jobs, and that is in addition to important UK-wide measures such as the Job Retention Scheme. We've also set out plans to support jobs and rebuild the economy in our response to the reports of the Economic Advisory Group and the Enterprise and Skills Strategic Board. That set out, amongst other things, our commitment to creating a youth guarantee of opportunities for young people, and we will, of course, set out further detail of our support in our programme for government that we will set out to the Scottish Parliament at the start of September. I have 2 further items I want to cover today. I want to update you on the different clusters of cases that we're seeing across the country, and I'll then set out our decision in relation to the restrictions that are currently in place in Aberdeen. I'll start with the cluster in Cooper Angus, which is linked to a Two Sisters food processing plant. My figures at the moment say that 17 cases have now been confirmed as linked to this outbreak. 15 of those are employees of the factory and 2 are people in the wider community. Contact tracing there is ongoing. Now, these figures will be updated after the incident management team meets later today, and I would expect these figures to rise from those that I've reported now. The factory has been closed down for a 2-week period. The 900 workers have been advised to self-isolate and a mobile testing unit remains on site so that the whole workforce can be tested. I also mentioned yesterday cases involving school students who go to primary schools in Blairgowrie, Perth and Paisley. Deputy First Minister will say a bit more about cases where there is a connection to pupils or schools, but I can confirm that there are 2 new individual cases involving people at schools in Johnson and Dundee. The health protection teams in these areas are dealing with these cases and have written to parents and carers of children in relevant classes, advising them where necessary that children should isolate. Again, these are situations that we are monitoring extremely closely. That's also true of the cases which have been linked to secondary school pupils, such as the cluster in Lanarkshire and the one in North East Glasgow. And let me remind you, as I did yesterday, these are community clusters with links to schools. They are not school-based clusters. The number of confirmed cases associated with the Lanarkshire cluster is now 9. That is a rise of 1 from yesterday. Now, all of these outbreaks are being looked at and followed up by our Test and Protect teams. And we're also today publishing more detailed figures on the overall work Test and Protect has done over the past 2 months. These figures, which for obvious reasons exclude cases that are still in progress, show that since the 22nd of June, Test and Protect teams have contact traced more than 900 positive cases. Of the people identified as requiring contact tracing, only 3 individuals out of 925, to be precise, couldn't be contacted. In other words, teams have traced 99.7% of those positive cases, which is a quite remarkable achievement. And based on that work, the teams have also traced more than 5,000 contacts, and they have been successful in contacting 98.8% of those individuals. Again, a very important achievement indeed. And it demonstrates the fantastic work that is taking place in health boards across the country. So I want to take this opportunity to thank all of our Test and Protect teams who are helping through their valiant efforts to keep this virus under control. I'm particularly grateful, of course, to the team in NHS Grampian who are helping to deal with the situation in Aberdeen. That is, by some distance, the most significant outbreak that we've had in Scotland so far. I mentioned earlier that 15 of the 50 new cases reported today are in the Grampian area. On the latest figures available, a total of 398 cases have been identified in Grampian since the 26th of July. 226 of these are associated with the cluster linked to Aberdeen pubs, and 1,141 contacts have now been identified from those 226 cases. And to give another indication of how effectively the Test and Protect team is working, more than 90% of cases and contacts identified in Aberdeen in the last 3 days alone have already been contact traced. Now, there's no doubt that these efforts, combined with the restrictions that were put in place, are now having an impact. There is now some evidence that the original cluster linked with bars and nightlife is being contained. However, we are also continuing to see a number of individual cases and other smaller clusters in the city. That's not necessarily unusual for an outbreak of this scale, but it is something we must monitor very carefully because these cases don't appear to be linked to the original outbreak. In addition, the number of new cases in Grampian over the past week remains higher than in other parts of the country, and it continues to show some volatility. And to give an example of that, the number of cases I've reported today for Grampian is double the number that I reported yesterday. So while the situation is undoubtedly improving, and I don't want to lose sight of that point, we are not yet in a position to say that this outbreak is over or completely under control. In particular, we continue to have some concern that the level of transmission not associated with the hospitality cluster remains elevated. And again, to give some illustration of that, as of today, the figure for that non-hospitality related case number remains in Aberdeen over 20 per 100,000. And by contrast, the 7-day rolling average for the rest of Scotland is around 6 per 100,000. It's therefore the Government's view, based on clear advice from the Chief Medical Officer and the National Clinical Director, that it is not yet safe to lift these restrictions immediately. I know this is disappointing. The Council in particular, for understandable reasons, is keen to see restrictions lifted, a view they expressed at a SCORE meeting that I chaired earlier this morning. We've also taken into account the view of the local incident management team that the main cluster is increasingly under control. But moving too quickly with transmission levels as they remain just now would, in our view, risk the hard-won progress that people in Aberdeen have made. As a result, it is our conclusion, reluctantly, and this has been a difficult decision this week, that hospitality businesses such as pubs, restaurants and cafes will remain closed and the restrictions on household gatherings and travel will remain in place for a further week. However, I do want to signal as much certainty as I can at this stage to people, businesses and the wider local economy about when they can expect to see restrictions eased. Assuming that the numbers continue on a downward trajectory, we will aim to start lifting restrictions from next Wednesday. At this stage, we hope that this will begin with the reopening of lower risk premises such as non-licensed cafes from next Wednesday. We have also agreed this week to undertake a midweek review on Sunday with a view, if possible at that stage, to confirming what I have just said about lower risk premises, but also at that stage setting out a firmer timetable for the lifting of other restrictions, and we will seek to do that as quickly as we consider it safe to do. I want to reiterate my thanks to people in Aberdeen for complying so well with these rules over the past couple of weeks. Nobody wants measures to be in place for longer than is necessary, but it is really important at this stage in the pandemic that we continue to take a precautionary approach. Our hope is that by sticking with these restrictions for a little bit longer and ensuring that this outbreak is firmly under control, both the cluster and the more sporadic cases that we've been seeing in Aberdeen, we can avoid further more severe restrictions in the future. That said, I appreciate that this is exceptionally tough for everybody in Aberdeen, but it is tough for the business community. I'm therefore announcing today an immediate £1 million support fund for businesses in Aberdeen. The fund will be delivered by Aberdeen City Council. It will provide grants of up to £1,500 for hospitality businesses that have been required to close. A small part of the fund will be used to help other businesses which, while they've been able to remain open, have felt the financial impact of the restrictions. For example, supply chain businesses or certain hotels or shops. Aberdeen Council will administer the fund, which will open from next week, and they'll provide more detail on how to apply in the coming days. And of course, we'll continue to discuss with Aberdeen Council the impact of these restrictions and what more can be done to help. Now, before I hand over to the Deputy First Minister and then with the Chief Medical Officer we take questions, I want to just close by reminding everybody again of facts and reminding everybody again of the continued fragility of the position that we face. We see countries quite close to us, Ireland, for example, describing themselves now being at a tipping point and having to continue some lockdown restrictions for longer. And that is an illustration of just how fragile the position all of us are in right now. And that makes decisions that government have to take difficult, as we see today with the decision on Aberdeen. But it makes the responsibility on all of us to do all of the right things, to play our part in keeping things firmly on the right side of a tipping point and not allowing them to be on the wrong side. It makes that responsibility even greater. So let me end with the usual exhortation to everybody to abide by the facts advice. Wear face coverings in enclosed spaces. Avoid crowded places, whether they are indoors or outdoors. Clean your hands and hard surfaces regularly. 2-metre distancing remains our overall advice, and self-isolate and book a test if you have symptoms. All of us, in abiding by these things, provide that first line of defence against this highly infectious and highly dangerous virus. So let's all recommit ourselves to acting individually in that wider collective purpose that we have, that has served us so well over these past few months. Thank you very much for listening to my slightly longer than normal presentation today. I'll hand over to the Deputy First Minister and then the three of us, of course, will move on to questions.
Thank you, First Minister. As a direct result of the commitment shown by members of the public in adhering to the measures in place to suppress coronavirus and the collaborative approach taken by all of our partners, we have been able to reopen our schools. This is a significant milestone in our recovery from COVID and a recognition of the importance of having our children and young people back in school. Overall, the feedback from schools and local authorities has been positive since the start of term. There has been real joy for many at the return of school. This positive response to having pupils and staff back in school was very much echoed by secondary school head teachers with whom I spoke yesterday, and I'll speak with primary head teachers tomorrow. As we continue through the new academic year, our schools and teachers will face many new challenges. It is vital that we do not see these as a barrier to education recovery and renewal. Through working in partnership, identifying solutions and sharing the common goal of keeping our schools open, we have made that a reality. We are regrettably, but perhaps not surprisingly, now seeing some small clusters involving children and young people across Scotland, and reports of new cases are being monitored closely by public health teams and local authorities. This is, of course, worrying news. However, those affected are self-isolating, and local authorities are doing everything necessary to ensure the safety and the well-being of pupils and staff. Managing this situation is why we have implemented a series of measures under our enhanced surveillance and testing programme for schools. The surveillance and testing approach is an essential component of our joint planning to ensure that we continue to provide a safe and welcoming environment for pupils and staff. Officials are working with Public Health Scotland to ensure data from the testing programme can be accessed as part of the surveillance effort. Throughout the COVID response, the Government has been guided by the latest scientific advice, and that advice informed our guidance on preparing for the start of the new school terms. The safety and well-being of staff is paramount, and the guidance sets out clearly what health mitigations should be in place. The scientific advice has set out that distancing between pupils and face coverings are not required within the school setting, as long as population prevalence remains low and other mitigations are in place. As an additional precautionary measure, the guidance asks secondary schools to take practical, proportionate steps to encourage distancing between young people, particularly in the senior phase, and those who wish to wear face coverings should be able to do so. These go beyond the requirements of the scientific advice and represent practical measures to minimise risk. At my request, the COVID-19 subgroup on education and children's issues has reviewed the advice on the use of face coverings in the light of experience of school reopening in Scotland. It noted that although school-aged pupils in Scotland have tested positive since schools have reopened, there is no evidence that transmission has happened within the school. The subgroup also emphasised the need to recognise face coverings as one of a package of measures and not a mitigation that should be applied in isolation. While face coverings are effective at reducing transmission of this virus, they also have some negative effects on communication and learning. These risks therefore need to be kept in balance. The group will continue to keep that evidence under review and provide further advice for the Education Recovery Group to consider at the earliest possible opportunity. Even before schools were reopened, it was clear that different schools would employ different approaches to minimise risk. As I've said before, going back to school is not the same as going back to normal. School life feels very different for pupils, parents and staff. To share learning, I'm asking Education Scotland to ensure that systems are in place and with local authorities and schools to share examples of good practice in the implementation of these measures. I know this will be one of the ways that we can support our school staff as we implement the decision to reopen schools. One of the most important ways this Government has supported this common goal is through crucial investment to support schools and local authorities, and we've made available a total additional investment of £135 million to ensure that children, young people and staff could be welcomed back into schools. We hope that by the recruitment of additional teachers and putting more of those teachers into classrooms, we will help to accelerate progress towards our overall aim of excellence and equity in Scottish education. We recognise there have been negative impacts of a prolonged period of lockdown, and now is the time to inject energy, pace and a renewed focus on all children achieving as a consequence. I want to ensure everyone that the situation in schools has been kept under close review, as is any emerging scientific evidence that will help us to protect the school community. We continue to work with teachers, parents, trade unions, local authorities and young people's representatives as we face the new term together. That collaboration is essential to promote education recovery, to encourage renewal and to build the resilient education system that we need for all of our young people.
Thanks, John. We'll move straight to questions now. First today is David Wallace-Lockhart from BBC Scotland.
Thank you, First Minister. With businesses in Aberdeen facing a third week of closures, are you confident a £1 million fund with grants of £1,500 is enough? We have heard from businesses who say that they are close to closure.
Look, we are making this money available immediately to the council as an immediate assistance for businesses that are facing a further few days of closure. We will continue to talk to the council about further support that we can make available. I have to be frank with people. We have limits to the overall amount of resource that we can call on, and I won't go into the arguments about increased borrowing powers today, but we have restrictions on the totality of money that is available to us, but we continue to do what we can within that. The overall objective of the government, and I know it's one that the council share, is to get the restrictions lifted as quickly as possible. This week's review has been a difficult balance to strike because we clearly see an improving picture in Aberdeen, but there are also still signs that cause us concern. And in particular, as I said, the level of transmission that is not associated with the original nightlife related cluster. And that remains elevated quite significantly above the national average. And that says to me that we need to take another few days to give us greater certainty, because as we see with the way this virus operates, if we move too quickly, we can end up going backwards. So this is a difficult balance to strike, but we hope from this time next week we will start to lift these restrictions, and we hope that over the weekend, by doing that mid-week review, we can give, ahead of next Wednesday, greater certainty around the timetabling and sequencing of the lifting of restrictions. But I understand how difficult this is for everybody in Aberdeen, but of course in particular those businesses that are losing revenue as a result of the restrictions being in place. Ross Governance.
Would future localised lockdowns get a similar support package?
Look, we will address lockdowns as and when. I hope we can avoid future similar lockdowns, but I can't guarantee that. We will address them as and when we face them, because they may not all have exactly the same nature. This one has, for reasons people understand, involved the closure of hospitality. Depending on the circumstances of other lockdowns, should they happen, there may be different requirements that have to be considered. So we will continue to look at these situations on an ongoing basis. As I said before, we also are considering whether we can put any measures in place that give a degree of certainty. And I've used the comparison before, which is still under consideration, of the Bellwyn scheme that is in place for councils when they suffer severe flooding, where they can call on national support. So we want to make sure there is as much support as we can feasibly give, that has a degree of certainty, and we're working towards that. But it is also really important to retain a degree of flexibility, because not all lockdowns, and I keep prefacing this by saying I hope we can avoid them, but if we get into further situations of local restrictions, even if they're not what you would call full lockdowns, they may be occasioned by different causes of outbreak, and therefore they may require different responses. Gregory Hoare from ITV Border.
Thank you, First Minister. There are concerns in the wedding industry, which is really important to the south of Scotland, that things are moving slower here than they are in England. In Gretna Green, for example, 20 people are allowed to attend, whereas a few miles away in Carlisle, you can have 30. Businesses have told us they're desperate for a firm date, or at least a time frame for a wider reopening for the industry, obviously taking into account the fact that safety and health is the primary concern, but they say that many other industries have had that. I appreciate you might not want to give a date now, but in tomorrow's review of lockdown restrictions, are you expecting to be able to provide an update? And if not, what is your message to the industry?
Gregory, before I answer your question, can I just apologise, having called Ross Govans from STV, but then went back to David. I forgot to come back to Ross Govans, so I'll come to you next, Ross, if you can be ready for that. I'm not going to preempt the outcome of the review, which we will conclude over the course of today, and I'll set out to Parliament tomorrow. I absolutely understand the desire of the wedding industry to have a firmer date, and we will do everything we can to provide that. On the other side of that, we do know that indoor transmission and social gatherings indoors right now are proving to be one of the drivers of outbreaks that we are seeing. So we have to be cautious and careful about the restrictions and the way in which we lift those restrictions. So these are all decisions that we're having to take balanced judgments on, and none of it is easy or straightforward. As we have done right throughout this pandemic, we will try to get those judgments as right as we possibly can, balancing all of these different considerations. And I'll set out more about that tomorrow. But my message to any part of the economy that is still operating under restrictions is that we understand how difficult that is. But part of the reason, in fact, the overriding reason for continuing to be cautious about some of this is to make sure that we don't spark off increases in transmission that set economic recovery significantly back. Ross, I'll come back to you now with apologies.
Thank you, First Minister. Going back to the situation here in Aberdeen, isn't there a real danger that the compliance that you've talked about being so high in the city could now slip when City Council administration don't support your decision to extend the lockdown? And at least in part, you appear to have ignored the recommendations of the local outbreak management team.
We don't ignore anybody. The chair of the incident management team was involved in the SCORD decision this morning, as were the co-leaders of Aberdeen City Council. This is a difficult decision. I ultimately have to stand here as First Minister and take these decisions and be accountable for these decisions. And I've tried to get these as right as possible all through this. And I am going to continue to err on the side of caution because we know the consequences of not doing that and things getting out of control. Certainly the Council's view is that they want a quicker lifting of restrictions, and that is partly why we've agreed to do the midweek review to see if we can accelerate the timescale for lifting this. The IMT yesterday was certainly of the view that it was possible to look at a staged lifting of restrictions, although of course this morning we had the benefit of knowing what today's cases were, and I'm not going to speak for the chair of the IMT, but the chair of the IMT could speak for themselves, but indicated general support of a precautionary approach during the SCOR meeting this morning. So we're trying to balance all of these things. It's not about ignoring anybody, it's about trying to come to a balanced decision that is in the overall interests of getting the city back to normal. And I come back, I'm going to ask the Chief Medical Officer to say a word, because obviously his advice to me on these matters is an important factor in my decision making. But we have a situation where, as of today, the prevalence of the virus in Aberdeen, which is not actually associated with the cluster, it is the wider prevalence, is above 20 per 100,000. The rest of the country, over the past 7 days, the average has been 6. So there is a significant disparity there. And the danger is, if we move too quickly to take everything back to normal, that much higher prevalence figure, instead of continuing to decline, as it is declining, starts to tip over and go in the wrong direction. And that would set everybody back. So, these decisions are not easy. We all agonise over these decisions, but we're trying to strike the right balance in the interests of getting things back to normal safely as quickly as we can.
So I want to start off just by paying tribute once again to the work of the clinicians and the different agencies involved in dealing with the outbreak and wider situation in Aberdeen just now. I think some of the work has been absolutely exemplary. When you consider the tracing numbers that First Minister has outlined in her statement earlier on, these are world-leading numbers. To be able to contact so many people so quickly, not just in Aberdeen but across Scotland, is something that we should note. When we look at the data for the Grampian region, Aberdeen City and in particular just now, what we still see is that whilst there is lots of signs of encouragement that particularly the Aberdeen City cluster associated with the nighttime venues is slowing and coming under control, Some of the wider cases which are not associated with that outbreak still remain high. The infectious pool in this area still remains much higher than we would like to see. To give you an example of that, the Grampian figures in total estimate, as of yesterday, that within Aberdeen City there was a case rate, 7-day case rate per 100,000 of 42.4. The non-associated case rate per 100,000 was 25.8. Now, to put that into some sort of context for people to understand, when we're making the decisions in relation to international travel and whether we should consider particular restrictions on quarantine for countries, when we took the decisions last week in relation to some of the countries, for example, Netherlands, their case rates were at very similar levels that we saw there as well. What we're also seeing continuing in the Grampian region generally just now, but particularly in the Aberdeen City area just now, is the percentage positive rate for tests just now, and it remains much higher than the national average and at a level where we need to make sure that that reduces further for us to be confident that changing any of these measures isn't just going to result in a sudden increase in the case rate again.
Fraser Nicholl from Original 106.
Thank you, First Minister. I'm wondering if you can give an idea of how low the case figures will have to be at the review on Sunday for the situation to be deemed completely under control. And I'm just wondering if the Chief Medical Officer can say if he agrees or disagrees with the local incident management team that the outbreak is under adequate control.
Okay, I'll let Gregor answer that. Can I just remind people that we're talking here about an outbreak, the cluster associated with the pubs, which I think the incident management team do think now is under control or coming under control, but we have this wider transmission issue in Aberdeen which still causes us some cause for concern. In terms of the numbers, and this is a question I'm asked often, and the council unsurprisingly and legitimately were asking it this morning. I often pose it to Gregor and to Jason Leach, is what are the exact numbers that, and unfortunately it's not always possible to give exact numbers. You're making a judgment based on all of the data, the trajectories and the context in which this is in. And Gregor will give a clinical view of this. I would like to see this number per 100,000 be under 20 and starting to head closer to a range that is closer to the rest of the country. And I want to have confidence that these numbers that are not just associated with the cluster but in the wider community are firmly coming down. Now, there is a bit of caution has to be applied to daily figures, which is why we talk about 7-day rolling averages, but we're still seeing a bit of volatility. I reported standing here yesterday, 7 cases for Grampian. I'm reporting 15 today. So all of this tells me that we just need a little bit more time to be confident that this is coming under control, both in terms of the cluster and the wider transmission across the community. Because the danger is, if we go back to normal with people interacting as normally too quickly, then a very fragile situation, instead of continuing to improve, will tip over the other way. And that is what we need to avoid.
So I don't think that the chair of the incident management team in Grampian or myself disagree that actually the evidence suggests that when you look at particularly those cases that are not associated with the city pub cluster, that there's still a bit of instability in relation to the numbers that we see there, and that they're still much higher than we would prefer to see them, to have absolute confidence that there isn't background transmission still taking place within that area just now. And what I heard in the discussion both yesterday with the IMT and again this morning was the chair's view that the approach that has been taken, adopting that precautionary principle to make absolutely sure we don't risk losing control again, is an appropriate one.
Phil McDonald from Global.
Thanks, First Minister. Just to follow up on what Ross was asking, do you fear that the local lockdown in Aberdeen may be at risk because of the council's comments? And what will happen to businesses who feel that they have the council's blessing and decide to reopen over the weekend?
Well, the appropriate regulations will remain in place for the next week with the appropriate enforcement powers attached there. But yeah, my apologies to Ross, actually, this was an aspect of his question I didn't come back to. I've got great confidence in people's willingness to understand why we're asking them to do things. I don't expect it to be popular. If I'd tried to get through the last 5 months with always taking decisions that people would find that they loved, then we'd be in a pretty sorry state right now. I've got a responsibility to come to a judgment about the right thing to do, even if it is really tough, because by doing the right thing in the short term, we hopefully avoid greater pain in the longer term. And I think people get that. I think they understand that. And notwithstanding the council's desire to move more quickly, I hope the council will understand and appreciate the reasons why we've arrived at this. They were a full part of the discussion this morning. They've, heard Gregor, they heard Jason, they, heard the numbers that I've been citing today. So they're entitled to come to a different view about the pace of lifting these restrictions. But I would hope, and I'm sure, knowing them as I do, that they will be responsible in encouraging people to comply with what they're being asked to do, because it is for the greater good of everybody across the city. Alan Smith from Bauer.
Thank you, First Minister. My question relates to adult daycare services. Radio Tay has today spoken with the family of a severely disabled Dundee man who, prior to lockdown, was going to adult daycare 6 hours a day. His centre says it's still waiting on the more detailed guidance from the Scottish Government before it reopens. Could you provide us with an update as to when we can expect that guidance to be published? And what is your message to families like that of John Kerr, who say that they're feeling isolated and pretty desperate at this stage?
My message would be I absolutely get that, and I just would encourage people in that position, like I would encourage everybody, to understand that none of this is done lightly. Where there is a restriction remaining on people's ability to interact face-to-face, it is for the wider objective of trying to reduce transmission risks. But on the substantive issue, I hope the guidance will be published soon, and I will give more clarity about the way forward in terms of some of these services when I give the outcome of the review tomorrow in Parliament. I don't know about you want to say that. Craig Payton from PA.
Thank you, First Minister. In early July, new cases fell as low as 2 in one day. Yesterday we saw 49, and today we've seen 50. I'm wondering if you would say that we're experiencing in Scotland is the second wave of the virus, and how concerned is the Scottish Government that that may be the case? Also, I'd just like to find out if daily cases were at the same or similar rates as they are now at the beginning of this month. Would that have ended with a delay in the opening of schools?
I'll ask the Deputy First Minister to say a bit more about schools. Much of what we're doing right now in trying to be very cautious about moving ahead, and this actually applies in Aberdeen as well as countrywide, is to keep community transmission as low as we can in order that we can safely have schools open on the basis that they're open right now. So that is a judgment we are making in the interests of the overall well-being of young people. And so some of the caution that we are applying right now is to stop community transmission becoming a risk to the continued opening of schools. Because as I was saying yesterday, and I've alluded to this again today, the clusters or individual cases we are seeing affecting school pupils or others associated with schools, they are community transmission. They are not transmission in schools. So the risk to schools right now is if community transmission runs out of control. So these things are closely connected. On the first part of your question, Gregor, after I've asked the DFM to talk about schools, may want to say a bit more about the technicalities of first wave, second wave. I'll do it from my politician, non-clinical perspective. I think what we're seeing right now is a spike in the first wave. I think the scientific opinion is still out. Scientific jury, if you like, is still out on whether this is a virus that will, like flu, follow a seasonal pattern, so that in the autumn, winter, we'll see a seasonal surge that may be what you would describe as a second wave, or whether this is a virus that will simply consist of one long wave where it will go up and down depending on the restrictions and compliance with the advice that we're giving. So I feel that what we're seeing right now is spikes and clusters as we come out of lockdown. Because remember, the suppression we've seen over the past couple of months is not down to this virus suddenly deciding to pack up and go away. It's because we've locked it down, as we've locked ourselves down. So as we lift lockdown, we give it the chance to spread again. And as we see in these clusters, it takes those opportunities whenever it gets them. John, do you want to say a quick additional word about schools, and then you can give a more scientific view of that?
I will do, First Minister. I think the two important points that I'd make. One is that there has been a very significant fall in daily cases from the period in late May, early June, where we were looking at all the issues around about school reopening, to the position that we faced at the end of July, when we took the strategic decision that schools were safe to reopen. So there has been a very, very significant fall in daily cases over that period. And the second point I would make is that when you actually look at the cases around the country, they are dominated by the ones that are announced today. They're dominated by 3 individual clusters, about which the First Minister spoke earlier on, completely skewed by those clusters. So the general prevalence of COVID around the country is at a very, very low level, but we do have individual clusters with which we are wrestling. And what we've got to minimise is any risk of community transmission, because what that will do is then endanger, run the risk that the virus spreads into schools, and we want to avoid that, because that runs the risk of interrupting learning.
Okay.
So we're not experiencing a second wave at this moment in time. In fact, there's many epidemiologists, public health experts who don't even agree with the terminology that's used there. We do need to understand why the numbers have risen, and certainly the evidence suggests that just now the increase in the numbers that we've seen over the last week or so is particularly driven by the presence of a number of clusters across the country, as have been described. Now, what we don't have any evidence for just now, and this is really important, is any evidence of sustained community transmission across Scotland that would signify we could be at risk of moving into another rapidly increasing phase of cases at all. However, as I've said many times before, we need to guard against that. We need to continually be vigilant that we don't allow that to happen. We've come out of a very artificial situation over the last few months, whereby as a nation, as a population, we've tried to limit our contact with others, and as those contacts increase, it's almost inevitable, while this virus still persists, that the number of cases will rise. At the moment, these are confined to clusters. They're being dealt with very quickly by the contact tracing efforts that go around about them. We need to make sure that they don't allow to establish wider community transmission, which would signify a wider resurgence of this virus.
Thank you. Where am I? Tom Peterkin from P&J.
Good afternoon, First Minister. In a joint statement, the leaders of Aberdeen and City Council have warned that the PACE notifications suggest that more than 5,000 jobs are at risk, and they say that the lockdown is harming the economy and making a bad situation worse. I mean, is this fund that you put in place enough to mitigate this? And secondly, is there an explanation for this transmission outside the pubs cluster that's causing you concern?
Gregor can explain that. As I understand it, it is not unusual to see in a big cluster some impact on individual cases and smaller clusters, not directly linked to that, but in some way associated. So it's not unusual, but it does still causes concern. On the Council's position, look, I respect the Council's position. I respectfully disagree with it. I think if we get ourselves into a position, and I say again, you know, in every one of these decisions, to argue that there is black and white, absolute right and absolute wrong is just a fallacy. These are really tough judgments to reach. But if we allow ourselves to be in a position where, when a situation is still on the cusp and fragile, as I think Aberdeen is, if we move too quickly to lift restrictions, the danger is we tip it back the way instead of continuing to see it improve, and many more jobs then become at risk, and the impact on the economy overall is greater. So, you know, I've said this so many times and people have heard me, I agonise over every single one of these decisions, as everybody who's part of our decision making does. They are horrible decisions to have to take, because whatever you do, there is an impact and a consequence. But I've got to try and do what I think is right in all the circumstances and balance all of these different things. And, you know, I'm not underplaying every day that a business is closed, what the impact of that is, because it is significant. But what we're talking about here is a difference of opinion, I hope, simply over a few days. And that few days is simply about giving ourselves the assurance that a situation here is sufficiently under control, that the impact of easing restrictions is not going to send it backwards. And I think that is really important, tough though the consequences of it I know are. And on the financial thing, I've already addressed that in earlier questions, but we will continue to talk to Aberdeen or other councils as necessary about the ability of the Scottish Government to give additional financial support, and we will do that to the best of our ability. Of course, we are also seeking, as others I know are, to persuade the UK Government not to withdraw the furlough scheme, the job retention scheme, in October, because the continuation of that is also an important protection as we continue to grapple with the consequences of what the virus is doing.
So what we're seeing in Grampian, and particularly Aberdeen City, where we're particularly interested, is in the non-associated cases, we're seeing a number of sporadic cases which, when the contact tracing teams try to establish whether there's any clear links back to the original cluster, they've been unable to establish that. So they're sporadic in their nature. And the reason that's important is because both IMT and clinicians locally cannot be certain as to the origins, as to where those infections have arisen. Now, when we look at the data for there just now, those levels still remain fairly high. And though they've been reducing, as have the associated cases, they've been a little bit slower to do so. So we just need to be careful that what we don't do is, while there's an infectious pool there, is to allow those bridges of transmission to be associated again, and for people to come together in a way that allows those infections to kind of transmit more readily across the system.
You know, we see other parts of the UK right now with varying degrees of lockdown restriction. Leicester, for example, still has, I understand, some lockdown restrictions in place, some 6 weeks after the initial period. So it can take time to get these outbreaks under control. I hope it will not be 6 weeks in Aberdeen, but it is important to remember the cycle of this virus and the time it takes to give yourself certainty that it is under control, so that you're not immediately sparking a igniting of a cluster by moving too quickly. Mark McLaughlin from The Times.
Good afternoon. One for the Education Secretary today. Matt Hancock has said that he would look at lifting the cap on medical student places this year in light of the exams. Will you do the same? University of Scotland has said that they've been asking you to do the same and asking for it to be fully funded. And if you do that, given it costs 3 times as much to train a medic, will you fully fund it in a way that doesn't eat into the students who want to get on cheaper courses? And finally, medical degrees is one of the only degrees that requires an entrance exam, the UCAT. Are you confident that there won't be any reduction in the passes of UCATs this year, given the questions over the robustness of the higher grades?
On the point in relation to university places in general, we're having very constructive discussions with University of Scotland about the expansion of places in accordance with the statement that I made to Parliament last week, and we have committed that we will fully fund the places that we take forward. In relation to medical degrees, again, that's an active discussion that is going on involving the Health Secretary, myself and the universities about the approach that we will take there, because quite clearly there is an opportunity to increase the number of medical students, but we have to be, there's another element of that we have to take into account, which is the capacity of the National Health Service to be able to support those medical students throughout their degree course. And finally, in relation to UCAT, I don't have any concerns about the UCAT entrance examination. I know that certainly some individuals that wrote to me in the course of our addressing our issues about the exam results who had sat the UCAT exam and were in a strong position, but their results had not been what they had looked for, but obviously that issue's been remedied by the announcement I made last Tuesday.
Tom Martin from the Daily Express.
Hi, thank you, First Minister. Can I just return to today's GDP figures? Not only do they show the country in a deep recession, but also June's slight recovery lagged behind that of the whole of the UK. How much do you think your more cautious approach, for example, the later reopening of shops here, has contributed to that?
I think some of the figures today you'll see slightly below the UK, others will be more on a par. I think overall, I don't think Scotland is in a particularly different position when it comes to the severity of the economic situation we are facing. Obviously, the other factors that we will always find in GDP figures is the slightly different structure of the Scottish economy. Hospitality and tourism, for example, is a bigger proportion of the economy, and obviously it has been more or harder hit than some other sectors, although the economy overall has been hard hit. So we will see some differences there, but the overall direction, I hope, is a strong one, which is building on the recovery we saw in June. We were in June, of course, still in a position across the UK, but slightly more in Scotland of still having significant lockdown restrictions in place. But as I've said all along, the benefit of that we are seeking to get is a much stronger foundation for medium to longer term economic recovery, so that while, as we see in Aberdeen, we can't guarantee this doesn't happen anywhere in the country, but overall we keep moving forward as opposed to lifting restrictions too quickly and then having wholesale to go back the way. So I think that the approach we are taking, though difficult in the short term across the UK for the economy, is giving us the best chance of building that solid foundation for the recovery that we are very focused on supporting. Rachel Watson from the Daily Mail.
Thank you, First Minister. This one's for the Education Secretary. I just wondered, we've spoken about, today the First Minister's spoken again about clusters related to schools, and I just wondered what your advice would be to any parents who are concerned about their child going to school and considering keeping them off because of this. And has the government been made aware of any cases like that where parents aren't sending their children to school?
Thanks, Rachel. The attendance at school is really very, very high and very good, and I thank and commend parents for their commitment to return their children to education. On Monday, the attendance was reported at 94.8% of pupils. The number of the proportion of absences that were authorised and unauthorised, but not related to COVID, was 4.6%, and the number of absences for COVID-related reasons were 0.7%. So we can see from that data that in an overwhelming fashion across the country, parents have returned their children to school, and I commend them for doing that. Obviously, we've set out in the guidance the measures that are in place to make our schools safe, and I know that schools are taking that approach very, very seriously, and it is different to how school was before. So there is a whole series of measures that have been taken, both in terms of hygiene, in terms of the school routine, in relation to issues around lunch breaks and other breaks, where the arrangements are different to improve safety and security. So what I'd say to parents is that there's very strong guidance in place. It's been actively implemented by schools, and parents should be confident in those arrangements. And where there are individual examples of very, very small clusters, the appropriate action will be taken to protect the safety of staff and pupils in every case. And that is being taken forward in every case. And I suppose my last point is just to reiterate a point I made earlier, that we will continue to keep the arrangements within our schools under active review to make sure we're doing everything possible to be assured of the safety of staff and pupils.
Derek Healy from the Courier.
Thank you, First Minister. You've spoken before about house parties and the hospitality industry as being linked to previous outbreaks. Is there any information at this stage about how these new cases in Aberdeen, not linked to the pub and bars outbreak, have been able to spread when lockdown measures have been in place for a number of weeks now?
I want to say more. These are sporadic cases, so they will not all necessarily have spread beyond the individual cases or small clusters there. But I'll ask Gregor to say a bit more if we do, because I think part of the problem here is that the ones not associated with the cluster, we don't know definitively where they have originated from.
So there's a lack of information that exists as to where these sporadic cases have arisen from. What we do know is that in some of those cases there's been further household spread that relates to them. So we know that household spread is one of the most common ways that this virus transmits to other people. But by the very definition of sporadic cases, they've not the tracing teams have not been able to identify fully where the cases have arisen from. What they have established is that they do not appear to be linked back to the original cluster, which had its basis on that central Aberdeen night scene.
Alistair Grant from the Herald.
Hi there, thanks very much. A new survey published today has shown that NHS workers in Scotland say they are at breaking point due to staffing shortages and heavy workloads, with more than half of them saying they don't feel valued in their jobs. Unite, the union, is saying that the findings should act as a wake-up call and is calling on the Scottish Government to reopen pay talks following the coronavirus crisis and the ongoing difficulties faced by staff. I just wondered what your reaction was to this and what you would say to those NHS staff who simply don't feel valued for what they do.
I'll say a couple of things. Firstly, the first thing I would say is I absolutely appreciate that for NHS staff or social care staff here in Scotland, as in any country, you deserve more than words. You deserve to see the appreciation and the value reflected more generally than that, and that's something we take very seriously. But words do matter, and I will never, although they matter, I will never be able to find the words to properly convey my appreciation and admiration for people who've worked in our health and care services over the past 5 months. As you know, I spent 5 years as health secretary. I saw up close the wonders that our NHS staff do day and daily. I have family members who work in the front line of the health service, so I know that from that personal capacity. But even taking all of that into account, what I've seen and what I have been aware of in the past few months has deepened that sense of appreciation and obligation to our healthcare workforce. We have always tried through pay deals and negotiations to the wider ways in which we seek to appreciate our NHS staff, with the exception, just as random examples, and I don't for a minute think that they add up to everything that we owe our NHS staff. But in Scotland, unlike in other parts of the UK, with the exception of PFI car parks, we a long time ago took away car parking charges because we didn't think it was right to have those in place for NHS workers. We retained the bursary for nursing students because we think it's really important to support them properly through their training. Just as a couple of examples of things we've done here in Scotland that haven't always been replicated elsewhere. And that obligation is even greater given what we have lived through and still live through. We are in the final stages of a 3-year deal for Agenda for Change NHS staff, and the Health Secretary will be taking forward the negotiations for the next period of that. And it's important in those negotiations that we reflect on what that workforce has been through and the understandable sense of, for a lot of them, probably exhaustion and the mental impact that particularly those in, for example, IC units will have dealt with over the past few months. So we have to turn these words, as we will always seek to do, into action that makes a difference for those working in our health service. And that, it takes hard work and it takes commitment, and we are dedicated to that. But the entirety of the NHS and social care workforce, I should know the depth of appreciation, not just that government feels, but I think everybody across the country feel. And obviously the pay negotiations over the period ahead will be not the only way, but an important way of making sure that is properly reflected. Simon Johnson from The Telegraph.
Good afternoon, First Minister. Just following up to your response to Craig's question about the recent spike in cases, I just wondered if you could rule out reimposing lockdown restrictions in some way, shape or form in tomorrow's review.
I'll set out tomorrow's review when I set out tomorrow's review, and I'll do that to Parliament, and you know well why that is the case. I hope tomorrow will simply be, and we haven't concluded that review yet, which would be the other reason why I can't give definitive answers to it, but I very much hope that even if it is not as quickly as everybody wants, the forward movement will still be very much forward movement and not backwards movement in terms of the lockdown restrictions. I suspect there will be, after tomorrow, sectors who might wish we were doing that more quickly, but hopefully they will nevertheless see that we are continuing to move forward. But beyond that, and don't take this as a comment about tomorrow's review for the reason I've just told you, I can't give you the answers on that. I can't, going forward, I can't rule anything out definitively. I would dearly love to be in a position of being able to do that, but by the very nature of an infectious virus, it is not possible to do that. And that brings me back to my central point that I repeat every single day, is that all of us have to try to act in a way that makes the re-imposition of lockdown at any point in any part of the country less likely by keeping this virus under control. And that comes down to every single one of us. Vivian Aitken from the Daily Record.
Good afternoon, First Minister. I don't know if you saw the tweet this morning that I saw, but it showed a corridor in a Scottish secondary school where the children weren't even not social distancing, but were virtually on top of each other going along the corridor. I heard what the Deputy First Minister said about masks and how they were continuing to look at guidance. But do you think that perhaps in corridors, at least when masses of children are moving between classes, that face coverings are something that we should really be looking at? And secondly, you released the lockdown restrictions for children under the age of 11 because it was widely believed that children of that age were less likely to get the virus. We're seeing with sporadic breakouts in primary schools that children are actually getting this virus now. Is it a time to reconsider those if we think that children of that age can get them and take them home to grandparents? There's maybe a greater risk than we first thought.
To John in a second, but can I just be really clear here, Vivian, and I appreciate you maybe didn't intend to use this language. We are not seeing outbreaks in primary schools. We are seeing individual cases of primary school aged children, but the evidence so far is that they are getting the virus in the community. It's really important, and now, this may not always be the case. We have to contemplate that we may see outbreaks in schools at some stages, but right now that is not what we are facing, and I think it's really, really important that, if I may say so, the media help us to be responsible in how that is reported and narrated. And if that changes, we will be open about that. And we've never said that younger children can't get this virus, and it's also really important to be clear about that. But the evidence so far is that younger children, and as you've heard me and Gregor and Jason say previously, there's not absolute cut-offs here, it's a gradation. So the younger that you are, the less likely you are to transmit it. Not impossible, but less likely, and also the less likely you are to have a severe form of illness. Now, none of that should take us to a place of complacency. We absolutely have to keep monitoring all of this. And before I hand over to John, I've not had time to be on Twitter for the last couple of hours, I'm afraid, so I've not seen images this morning. I'd referred to images yesterday that I'd seen yesterday and made the point that when we see anything like that, directors of education in the relevant councils will be contacted to make sure that they are applying all of the right guidance. And we keep all of this under review, and that includes face coverings, so that we are striking the right balance between, as normal as possible in what is still an abnormal situation, learning experience for young people, but with the right mitigations in place.
The only point I would reinforce the point the First Minister has made about face coverings, that is one of the further mitigations that we will continue to look at. Our scientific advice does not recommend it as being required, but our guidance says that if individuals would feel more confident and safer in that respect, then they should feel able to do so. But it is an issue that we will continue to look at, because we are determined to work with our schools to ensure that they are very safe places for young people and staff to be at all times. And if there are measures we can take to strengthen that approach, we will be prepared to do so.
Conor Matchett from the Scotsman.
Thank you, First Minister. Just kind of following on from that question, really, and you talked about the potential for in-school transmission, which obviously we all know is a very real risk. And I'd be interested to know what the scientific evidence is telling you about at what point schools would close and what the government's position would be if there was sustained in-school transmission.
Our first task is to avoid that happening. What I've said is, just as I can't rule out lockdown restrictions at some point in the future, I can't rule out having a cluster or an outbreak that starts in a school. But everything we're doing right now, from the measures to keep community transmission low through test and protect, taking steps. So in cases, and there'll be parents perhaps watching this who are in this position who've had letters in the last few days, if their child is in a class with somebody who has tested positive for the virus, asking them to keep their child away from school and to isolate. So everything we're doing is to try to avoid that. And risk-based judgments will be made in individual schools if a class has to be sent home or if the whole school has to close for a period. And it's important that we make those judgments on that basis rather than setting blanket sort of trigger points right now. Obviously, if community transmission was to get back to the kind of levels we saw at a much, much earlier stage of this, through March into April, then having schools open full-time may be a different conclusion we reached about that. But we are not at that stage, and everything we're trying to do right now, as far as we possibly can, is designed to stop us getting back to that stage.
A couple of points to add to that. Obviously, we have the enhanced surveillance and testing programme within schools, which is designed to provide a further level of data and assurance about the measures that have been taken within schools and to act to minimise any cases that emerge. And the second point is to say that we will be very much focused on taking proportionate action along with local authorities to try to maximise the availability of young people to be able to access learning. Now, we did invest a lot of time and energy in the creation of the blended learning model, which was designed to deliver educational continuity where we were unable to do so on a full-time basis. Those plans are still available in all schools around the country, should they be required. But fundamentally, our efforts and our attention are focused on trying to minimise community transmission so that we protect schools and we can maximise the access to learning for children and young people.
And just final word, which I hope is doesn't take away the anxiety, because parents, of course, feel anxious about all of this, but gives a level of assurance. The fact that we're standing here every day right now and reporting individual cases, obviously not the identity of the cases, but an individual case with a school in Johnson. I wouldn't be standing here today telling you if an adult in Johnson as one individual case had tested positive. The reason we're giving this level of detail is to give a sense of how seriously all of these cases are being taken by schools, by Test and Protect, by the local health protection teams that deal with this. This is not something we are complacent about, but we also know that damage has been done to our kids from not having them in school for such an extended period. So getting them into school and into full-time education is really important, which is why we need to work so hard to maintain the conditions that allow that to happen safely. Christine Lavelle from The Sun.
Thank you, First Minister. It was just on schools as well. We're hearing differing reports of social distancing measures in primary schools, with some children as young as 5 being put into bubble-type groups of sort of 5 or 6 within classrooms and made to walk on lines and playgrounds to get to classrooms, for example. Given the government's guidance is for no social distancing between pupils in primaries, can you just explain what's going on to parents who might be confused or worried about previous warnings from mental health experts about the potential impact on young people of rules like these?
John, address that.
What I think you're referring to, Christine, is steps that schools are taking to try to minimise the possibility of transmission within schools. So they're trying to reduce the risk that is prevalent. Now, what they are also trying to do is to ensure that young people can have the good educational experience that we want them to have, where they can interact with other young people, they can interact with their classmates, but they are perhaps not as free to roam about the school as they may have been able to do in the past. So I think what schools are doing is feeling their way through what is a very difficult and changing environment, to find the best way in which they can support young people, to minimise the possibility of transmission whilst maximising the opportunities for access to education. And part of what I said in my own comments is the importance of understanding and appreciating how individual schools are reacting to these challenges, sharing good practice, and to make sure that Scottish education is able to respond to some of these lessons as we see the effect of some of the measures that have been put in place. But fundamentally, schools will be erring on the side of caution to make sure that they are minimising the risk of possible transmission of the virus.
And self-evident point is not all schools are the same shape and size, so there will be perhaps approaches taken in some schools that are different to other schools for obvious reasons of fitting the physical circumstances that are there. Andrew Learmonth from the National.
Thanks, First Minister. You said when Aberdeen went into lockdown at the start of the month that there'd be a probe into the source of the outbreak and how it spread so quickly. I was wondering if there's any update on that, if you had a better understanding of why that was the case. And secondly, given that Scotland's third biggest city is spending almost all of August in lockdown, are you confident still that it's safe to have pubs open in other cities across Scotland? Are the protection mechanisms working? And sorry, if I may, a question to the Deputy First Minister. I've spoken to a counsellor, a school counsellor and a social worker this morning, and they're both looking for a bit more guidance about when they might be able to get back into schools and have face-to-face contacts with pupils. Is that something you could give us an update on today?
I'll ask the Deputy First Minister to do that, and Gregor might want to say a little bit, or just on the IMT. IMTs will generally produce a report after an outbreak is concluded, looking at the circumstances and giving as much explanation of what happened there. Obviously, the IMT in Aberdeen is still in the phase of dealing with that, but that will happen in due course. I'll let John answer that. Gregor will want to say maybe a bit more about IMTs, and then I'll move on.
One of the things we're trying to do is to minimise the number of individuals who are accessing schools beyond the core staff and pupils within individual schools. So the guidance essentially tries to encourage the access to other services such as those of social workers and other professional staff to be done remotely with the support and the cooperation of schools, and obviously the technology exists for that to happen. We do, however, have the rolling out of the school counsellor programme to support the mental health of young people. That programme is due to be complete in October, and of course these are individuals who are full-time members of staff, so they are able to be in schools and able to deploy those services. And of course, through pupil equity funding, we have a range of professionals who are already in school staff who are able to provide support to assist the well-being of children and young people within schools.
And Gregor?
So I think we're all becoming familiar with the kind of term, the incident management team now, and this is a group of specialist clinicians and people from other professional backgrounds who come together when one of these incidents emerges. And they've got a variety of roles. Part of that is about risk assessment, part of that is about risk management, but it's also to try to determine if there's any lessons to be learned from it. And usually at the culmination of an incident management team, what happens is they do a reflection and review to see whether there is any wider learning for the system that should be captured and should be shared, or whether there's anything that they themselves would perhaps have done differently. One of the really fascinating aspects that we're starting to kind of see emerge during dealing with this pandemic is particularly the role of whole genomic sampling. This is the ability to be able to track families of viruses to see how they spread within communities. And because of the mutation rate of these viruses, we can actually see sequentially how some of these viruses and clusters actually emerge over time as well. Part of the response in Aberdeen City has been to make sure that we are capturing some of the samples to submit them for whole genomic sampling to try to get a better sense of how this infection spread within that environment and whether some of the sources are more clearly identified.
I'm Lastly, you asked, did I think it was safe to have pubs open given the situation in Aberdeen? I'm very clear pubs are one of the higher risk areas for transmission, but we know it's important to the economy to have hospitality trading again. We've tightened the guidance, we've put it on a statutory footing. I may say more about that tomorrow. But we're not seeing what we saw in Aberdeen in other parts of the country around pubs in terms of that scale of cluster. Obviously, if we did, we would have to contemplate action as we have done in Aberdeen. But that is minimised. The risk of that is minimised if pubs stick to the rules and make sure that the rules are applied in their premises rigorously, and people frequenting pubs, if they all stick to the rules as well, then we can keep the risk of that as low as possible. Last question today is Libby Brooks from The Guardian.
Thank you, First Minister. Scotland's Children's Commissioner this morning raised concerns about young people being scapegoated over infections at house parties, particularly when he says the messaging that they've been getting about gathering in and out of schools is, with the best will in the world, inconsistent. Do you think there is a danger of blaming young people unfairly?
I haven't seen the Children's Commissioner's comments on that front. I have huge respect for his views and his comments, but I do fundamentally disagree with the idea that we're trying to scapegoat anybody. I mean, I stand here every single day and really avoid blaming anybody for this. This is an infectious virus. It's nobody's fault. But I've also got a responsibility to the nation to point out what we understand from the evidence are the higher risk areas for transmission. And we know that one of those, not the only one, but one of those are indoor social gatherings. Now, that's not necessarily just young people, but obviously all of us, some of us struggle more than others to remember being that age, but young people do like gathering together. It's not blaming them for that to point out that that is a risk and asking them to be very careful about that. Of all the things that distress me about what we're living through right now, and that's pretty much everything that is associated with this, the impact on our young people is right up there at the top of the list. It's why we're so determined to get schools open and keep them open. And even if that means more sacrifices on the part of the rest of us to keep community transmission low. But, the summer that particularly teenagers have just lived through, when you're my age or your age, Libby, a bit younger than me, you can think, well, next summer might be different. You don't get your 14, 15, 16-year-old summer back. So the impact on our young people has been immense, and we need to try for their sake to get as much normality as possible. So it's not blaming them or scapegoating them in any way, shape or form. But I don't do them any favours if I don't try to point out where they're at greatest risk and try to minimise that, and to explain the differences that can be difficult for all of us to understand about why we're saying 2 metres distance in somebody's house with somebody from another household, but for reasons we have set out in the educational school environment, that can be different. These are complicated things, I understand that, but that's why 5 months in, we still stand here every day trying to communicate these messages as clearly as we possibly can. And that concludes questions for today. My thanks, as always, to the journalists and today to Gregor and John and Yvonne, who has been our BSL interpreter today, and my thanks to all of you. My particular thanks to those in Aberdeen who might be watching right now. I know another week with these restrictions is not what anybody wants, but whether you agree or disagree with that, please take my assurance that this has been done for the best possible reasons to make sure this outbreak and the wider ramifications of the outbreak are sufficiently under control so that we can move out of these restrictions without the undue risk of sending things into reverse. Thanks to everybody else, and I'll leave you with my usual plea to please remember the facts, advice, and to spread that word as widely as you possibly can. I will join you tomorrow, but from a different venue. I'll give the outcome of our 3-weekly review in Parliament tomorrow. I think that's around the same time, 12:15, 12:20, and that will be followed by the weekly session of First Minister's questions. So I hope you can join us then. But for now, thank you very much.